Hi everyone, welcome to the Specialty Optometry channel. Today we are diving into an essential topic in optometry, that is corneal disease and their classification. Whether you are a medical professional, a student, or just curious about the eye health, this video will give you a clear understanding of a different types of corneal disease and how they are categorized. First, let's briefly talk about the cornea and its normal dimension. So as we know that the cornea is a transparent avascular watch glass like structures, and it basically forms 1 by 6 of the total outer coat of the eyeball, and the interior surface of the cornea is elliptical and the horizontal visible iris diameter is 11.7 millimeter. However, the vertical visible iris diameter is 11 mm. The posterior surface of the cornea is circular and the average diameter is around 11.50 millimeter. The central corneal thickness is around 0.5 millimeter. However, the peripheral corneal thickness is around 0.7 millimeter, which is a bit thicker than the central portion of the cornea. The radius of curvature, the interior radius of curvature is 7.8 millimeters and the posterior radius of curvature is around 6.5 millimeters. So anything beyond this dimension will be considered as abnormal. So before discussing the classification of different types of corneal disease, let me discuss the congenital anomalies of cornea. So the first one is the megalocornea. So at birth, the horizontal visible iris diameter is 10 millimeter, and in adult, the horizontal visible diameter is 11.7 millimeters. That will attain by the age of 2 years. And if the horizontal visible iris diameter is more than or equal to 13 millimeter, then that will be called it as a megalocornea. Usually it is non-progressive, and there are some systemic association which is associated with megalocornea, like Morphan syndrome, Alport syndrome, Ehlers-Danlos syndrome, and Down syndrome. So there are some differential diagnosis of the megalocornea. So the first one is the ophthalmos. So in these conditions, the IOP is raised, and as a whole, the eyeball is enlarged. So the enlarged cornea is usually associated with the central or the peripheral cloudy and the descent membrane tears, that will be also called it as a hapstria, which you can see in this particular picture. There is a multiple folds which you can easily see in this particular picture, so that will be called it as a hapstria. So the next differential diagnosis of megalocornea is the keratoglobus. So in these conditions, there is a thinning and excessive protrusion of the cornea which seems enlarged, but its diameter is usually normal. So you can see in these pictures, so usually there is a overall bulging out of the cornea, and it is looking like that this is the megalocornea, right? But this is not actually the megalocornea, because usually the diameter of this cornea is normal, but because of the total bulging of the cornea, it is looking like that the cornea is larger as compared to normal. But this is the normal cornea. The diameter of cornea is. So next one is the microcornea. So in microcornea, basically the horizontal diameter is less than 10 millimeters since birth. And in these conditions, may occur in association with nanophthalmos, which is normal a small eyeball, or microophthalmos, which is basically abnormal is a small eyeball. So you can see this is a picture of basically the nanophthalmos, which is normally a small eyeball. This is the pictures which is showing microophthalmos. This is the abnormal, a small eyeball. So the another is the corneal plana. So this is also congenital anomalies of the cornea. So the cornea plana is a rare anomaly in which the bilaterally cornea is comparatively flat since birth, and this may be associated with a microcornea. Cornea plana usually results in a high astigmatic refractive errors. So this is the picture of cornea plana. So the next congenital anomaly is the congenital cloudy cornea. So the acronyms STUMPed help to remember the common conditions to be included in the differential diagnosis of the congenital cloudy cornea. So the first one is the sclerocornea.
So in a sclerocornea also you will be seeing the cloudy cornea and tear in the basement membrane that we have seen in the last slide, that will be also called it the half stria, in which also you will be seeing the cloudy cornea. Corneal ulcer, metabolic conditions like mucopolysaccharides, which is a metabolic disorders of the uh, body. The another anomaly is the Peters anomalies. This in these conditions also you will be getting you will be seeing the cloudy cornea. Endothelial dystrophy, especially congenital hereditary endothelial dystrophy. So in these conditions also you will be seeing the cloudy cornea and the limbal dermoid. So these are the conditions basically where you will be seeing the cloudy cornea, and that you have to differentiate it whether it is because of the congenital, like whether it is because of the developmental anomalies, congenital developmental anomalies of the cornea, or it is because of some other problem the cornea is having haze. It's very important to know. So next, coming to the inflammations of the cornea. So inflammation of the cornea is basically called it as a keratitis, and the keratitis is characterized by the corneal edema, cellular infiltration, and ciliary congestion. So there are different classifications of the keratitis or corneal ulcers. So it has been basically divided into two parts. One is the topographical, that is morphological classification, and another is based on the etiological classification. So let's go one by one. So the topographical or the morphological classification has been subdivided into two parts. One is ulcerative keratitis and the another is non-ulcerative keratitis. So first one is the ulcerative keratitis. So it has been subdivided into further different groups. So depending on the locations, it has been divided into two groups. It can be either central corneal ulcer or peripheral corneal ulcer or keratitis. And if you talk about the depending on the purulence, then it has been divided into again two parts. One is purulent corneal ulcer or suppurative corneal ulcer. So mostly the bacteria and the fungi corneal ulcers are the suppurative, and the another one is the non-purulent corneal ulcer. Mostly the viral, chlamydial, and allergic corneal ulcers are non-suppurative. The third one is the depending upon the association of hypopion. Either it can be without hypopion ulcer or hypopion corneal ulcer. So fourth, depending upon the depth of ulcer, so it can be either superficial corneal ulcer, deep corneal ulcer with embedding perforations, and the perforated corneal ulcer. And the another classification is the depending upon the slug formations. Either it can be non-slugging corneal ulcer or slugging corneal ulcer. So coming to the non-ulcerative keratitis. So non-ulcerative keratitis again subdivided into different groups. So based on the superficial keratitis, it can be either diffuse superficial keratitis or superficial punctate keratitis. And based on the deep keratitis, it has been again divided into further groups. So the first one is the non-suppurative. So the non-suppurative keratitis can be either interstitial keratitis, ischiform keratitis, or sclerosing keratitis. The another is the suppurative deep keratitis. So it can be either central corneal abscess or posterior corneal abscess. So now coming to the based on the etiological classification, it has been divided into several groups. So the first one is the infective keratitis. So infective keratitis can be either bacterial, viral, fungal, chlamydial, protozoal. The next one is the based on the allergic keratitis. So it can be either flick annular keratitis, vernal keratitis, and atopic keratitis. If we talk based on the trophic keratitis, then it can be either exposure keratitis, neuroparalytic keratitis, and keratomalacia. And there are other classification also. The keratitis associated with the disease of skin and the mucous membrane, and the keratitis associated with systemic collagen vascular disease or disorders. And there are some traumatic keratitis also, which may be due to mechanical trauma, chemical trauma, thermal burn, and radiation. And there are some keratitis which causes are still unknown. So that can be the Moran's corneal ulcer, superior limbic keratoconjunctivitis, or superficial punctate keratitis of facial. Thank you.